صباح الخير. اخباركم ايه؟ الجهاز رقم 3 معانا من شركة دي واسم الجهاز فينوفا فينوس ستنت سيستم. تم ترشيح الفينوفا ايضا لجائزة البريجاليان لافضل تقنية طبية عام 2020 السنة اللي فاتت. بيستخدم نظام الدعامة الوردية الفينوفا لإعادة فتح المناطق الضيقة من الفين الناتج عن مجموعة جلطات اللي بتتشكل على طول بطنة الأوردة بعد تجلط الأوردة العميقة اللي هي بيسموها متلازمة ما بعد الجلطة، أو لما بيحصل ضغط على الوريد اللي بين العظم والشريان المتغطي بيه. بتقل الحالات ديت من تدفق الدم في الساق، وبينتج عنها ورم في الرجل وألم عند المشي. بيعمل نظام الدعامات الوردية الفينوفا لعلاج الوريد الضيق الموجود في منطقة الحوض العلوية لغاية منطقة الفخذ. بيتكون النظام من جزئين: دعامة مصنوعة من أنابيب من سبائك النيكل والتيتانيوم، وجزء خاص بقسطرة توصيل الدعامة اوفر. أنا هسيبكم مع الفيديو اللي بيتكلم عن الجهاز وطريقة استخدامه. كان معاكم تامر، ودي up to date medical. شكرا، مع السلامة.
The Venovo venous stent system is indicated for the treatment of symptomatic iliofemoral venous outflow obstruction. The Venovo venous stent is a self-expanding nitinol stent that is specifically designed for the venous anatomy. It is available from 10 to 20 millimeters in diameter and 40 to 160 millimeters in length, and in 80 and 120 centimeter catheter lengths. Each stent features 3 radiopaque tantalum markers and 3 nitinol markers on each end. Each end is also flared 3 millimeters to ensure adequate wall apposition. The Venovo venous stent is loaded on a triaxial over-the-wire delivery system. The catheter is comprised of a guide wire lumen, stent delivery sheath, and system stability sheath. The stent is constrained in the space between the guide wire lumen and the stent delivery sheath. The guide wire lumen originates proximally on the handle with a Luer hub and terminates distally at the catheter tip. The guide wire lumen is compatible with an 035 guide wire. The delivery system handle includes 2 deployment thumb wheels. The large thumb wheel slowly retracts the stent delivery sheath during stent deployment. The small thumb wheel retracts the delivery system sheath faster during stent deployment. The red safety lock slider on the handle helps prevent unintentional stent deployment. In order to ensure a successful venous stenting procedure, it is important to choose the appropriate size. The stent diameter should be 1 to 3 millimeters larger than the reference vessel diameter. The stent length should be long enough to cover the area proximal and distal to the lesion. Refer to the stent sizing table for the appropriate stent size selection and the recommended guide wire length table for the catheter working lengths and appropriate guide wire lengths. Prior to stent deployment, examine the packaging and Venovo venous stent system for any damage, and verify that the red safety lock on the delivery handle is in the locked position. Do not use it if it is suspected the sterility or performance of the stent has been compromised. Flush the guide wire lumen of the stent system with normal sterile saline until fluid exits the tip of the system. If predilatation with a balloon is performed, select a balloon catheter that matches the size of the reference vessel. Now, advance the stent system over the guide wire through the introducer sheath. Remove the slack from the stent system held outside the patient. Any slack in the stent system could result in deploying the stent beyond the target site. Next, confirm the introducer sheath is secure and will not move during deployment. Unlock the safety lock by pulling it back towards the thumb wheels. Pull back the stent system until the distal and proximal stent radiopaque markers are distal and proximal to the target lesion site. Use your second hand to hold the stability sheath and maintain it under tension throughout the procedure. It is important not to touch the dark moving sheath during stent deployment. Begin stent deployment by rotating the large thumb wheel in the directions of the arrows while holding the handle in a fixed position. The delivery system during deployment. Using fluoroscopy, maintain the position of the distal and proximal radiopaque markers relative to the target site. Watch for the distal radiopaque markers to begin separating, indicating deployment. Continue turning the thumb wheel until the distal end obtains complete wall apposition. Do not attempt to recapture. Complete stent deployment with the large thumb wheel. Stent deployment is complete when the proximal stent radiopaque markers oppose the vessel wall. Post-stent expansion with a balloon dilatation catheter is recommended. If performed, select a balloon catheter that matches the size of the reference vessel, but that is not larger than the stent diameter itself. Remove the guide wire and introducer sheath from the body.